I'm Dr. Betsy Davis, psychologist and local recovery coordinator here at the South Texas Veterans Healthcare System. I'm also currently a pregnant person, and so May is Mental Health Awareness Month, but also Maternal Mental Health Awareness Month. So I'm here talking with a couple of our providers from the Women's Health Clinic about how maternal mental health fits in with the rest of VA healthcare.
Hi, I'm Dr. Anna Smitherman. I'm the women's health psychologist here at the VA and also one of our women's mental health champions here.
Hi, I'm Dr. Sally Driver. I'm the Women's Health Licensed Marriage and Family Therapist here and one of the team members helping with women's mental health.
Perfect. So let's dive in. Why is it important to talk about maternal mental health?
Sure. So while the image of a pregnant person may not be exactly what people think of when someone brings up veterans, in reality, we serve about just under 25,000 women veterans here in our system, and just under 12,000 of those are of childbearing age. So it's a big portion of our population that benefits from this discussion.
And remembering that as women veterans grow in number, in fact, they're the fastest percentage of people in our, general public retiring or leaving the military after service. It's going to be really important to be able to support them throughout their lifespan, including during those reproductive years.
Definitely. So my first question is, do veterans experience perinatal and postpartum mental health any differently from non-veterans?
Absolutely. So anyone who has a history of exposure to trauma or a pre-existing mental health condition is at a greater risk of developing postpartum depression, anxiety, and these things affect not just the pregnant person or new mother experiencing them, but also can impact maternal-infant bonding and the relationship between the parents. So it really affects the whole family.
Yeah. And it's important to start addressing it, hopefully, as soon as possible, maybe even before the baby's born. That way, instead of waiting until there's a problem and trying to address it then, we have a plan. It may sound pessimistic to say that, but it's almost like we have escape routes for our home or our place of business in the event of a fire. Same kind of idea. We want to have those supports and protections in place ahead of time.
Mm-hmm. And is there anything different about how veterans should approach their mental health during pregnancy?
Sure. So the transition to parenthood can be a great motivator to tackle things that maybe people were previously avoiding. So sometimes folks have not been motivated to take care of themselves when it was just them, but when they're thinking about taking care of themselves in service of their new child, they're a little more, it's easier to get the motivation. All of our typical mental health services are available and encouraged for pregnant veterans. And in terms of medication management for mental health concerns, we also have lots of prescribing providers who can help our veterans make the best choices both for themselves and for the pregnancy.
So it sounds like the transition to motherhood affects so many different parts of the veterans' lives. What other resources are available for veterans?
We're really fortunate in our clinic to have a relationship specialist to help couples transitioning to parenthood, coping with pregnancy loss, things like that. So I'll let Dr. Driver talk about those things.
So often couples come to therapy when they think, gosh, we're in a really tough place. That, the relationship's not going well, or we have this major transition and we're not sure how to handle it. And that's absolutely appropriate. And sometimes we're really excited, but we don't necessarily want to do what we've been doing or replicate what we saw in our families of origin. Those are great reasons to come see a couples therapist because they can help kind of navigate that and make a plan for what works for both partners. We also, though, do have times where couples are in those more difficult places and they want that help and the support, whether it's because they're going through a fertility journey, and that can be really demanding on that relationship, or they've had maybe the loss of a pregnancy or child. So all different reasons, and there's really no bad reason to seek therapy. And it's definitely great to do it ahead of time. Again, like we said before, having that plan and doing it preventatively.
So being pregnant and having a newborn, as I'm sure I'll learn soon, kind of makes everything more difficult, right? So is it really realistic for veterans to seek this type of care at this point in their life?
Absolutely. And we understand that there's unique challenges our veterans have as they navigate pregnancy and parenthood. And we don't want that to be a barrier to care, whether it's transportation or access to childcare. So our offerings are offered virtually. So they can join on their lunch break in a secure location. They can join from the comfort of their home. Whatever works best for them, we want to make sure that they're getting the support that they need.
Sure. We know that you might have to change a dirty diaper or nurse a baby while, attending your therapy session. And while ideally our veterans would be able to have that designated time and space for themselves, we know that's just not really realistic during this period for a lot of people. So we're not going to let that get in the way of care.
So what about other mental health needs? How can a veteran connect with services for those?
Sure. So if we meet with a pregnant veteran that's been referred to us or postpartum, and if we determine that they would benefit more from some of our other specialty mental health services, say the PTSD clinic for trauma-focused care, then we could facilitate that, help guide them, get them where they need to be, and ease that transition. We frequently collaborate with other mental health providers here at the VA. And of course, if somebody is already established with a therapist or a provider who they feel comfortable with and are making good progress with, then absolutely we encourage them to stay in that relationship, that therapeutic relationship, as they move forward through this transition for themselves.
Awesome. So how do people get connected with y'all services?
So they can ask their medical provider or a mental health clinician they're working with to place a consult for the women's health psychology, and their information is there for their provider to put in what's going on, that they would like to work with one of us, and then we'll reach out to get them taken care of.
Perfect. Sounds like a pretty easy process.
Yeah, we hope so.
Yeah. Well, we hope this information has helped make it a little bit clearer how the VA can support all veterans through different transitions of life, including pregnancy and postpartum phases of life. So if you have additional questions, feel free to reach out to your primary care provider or your mental health provider. Thank you.